This is Heart Rhythm TV, and I am Senior Correspondent Julie Shea here with another episode of Advancing Allies. On today's AP Spotlight, I have Dr. Heather Ross, who is a nurse practitioner at Honor Health Cardiac Arrhythmia Group in Arizona, and she is also a tenure-track assistant professor at Arizona State University. Among her other credentials, she has both a doctorate in nursing practice as well as a PhD in human and social dimensions of science and technology. She is a double IBHRE certified in both device and EP. She is a fellow of the Heart Rhythm Society and the American Academy of Nurse Practitioners. And I would like to welcome Heather to AP Spotlight today to mark her recipient. She's the recipient of the Distinguished Allied Professional Award for 2025. So Heather, welcome to AP Spotlight and congratulations on receiving such a distinguished award.
Thank you so much, Julie. I appreciate that. And I would be remiss to not mention that, I've followed you in a lot of things in my career. So thank you for being the tip of all of the spears.
Oh, well, thank you. I mean, you and I go back probably at least a quarter of a century at the Heart Rhythm Society, if not closer to 30 years that we've been kind of colleagues working together through FHRS. So welcome today. I wanted to kind of highlight your career and your involvement with the Heart Rhythm Society and how you ended up getting the award this year. So if we can kind of just take a little bit of a step back in time to kind of your early days, talking about how you got involved in the field of electrophysiology.
Sure. So I entered graduate school. My undergraduate degree is in a completely different field. And I was a master's entry student in nursing. And when I went to nursing school, I anticipated a career as probably a clinical nurse specialist in an ICU setting. And I completely fell into being a nurse practitioner. There is a wonderful, wonderful NP who is at Beth Israel Hospital in Boston. Her name is Carol Brown, and she was part of the inpatient cardiac service. And basically, these are the nurse practitioners who took care of the folks who were coming in for a cath or an EP study. And I didn't know there were nurse practitioners in hospitals at that time. I was brand new to nursing school, and she was just so wonderful and generous and kind of took me in and ended up being my primary rotation when I was a graduate student, and really moved me from an imagined career as a CNS to becoming a nurse practitioner and becoming a nurse practitioner in cardiology. So when my faculty at Boston College kind of found out that I was doing this rotation in cardiology, I then started to get more opportunities in cardiology, and I loved it. So people say, how did you get there? And I said, well, I kind of fell in, and then I stayed because of gravity. I mean, I loved it, and these opportunities kept coming my way. So when I graduated, I was very, very fortunate to, we moved to Philadelphia to the hospital of the University of Pennsylvania, and I was so fortunate that a nurse practitioner position opened up on the EP team. When I was working briefly as a staff nurse, I came to know some of the EP team, and particularly Erica Zato and Scott Cox, and they just really took me under their wing. And when this position became open, I was very fortunate to be hired into it. And one of the things that I really treasure about that experience is that as nurse practitioners and allied professionals and advanced practice professionals, we were just part of the team, and we were expected to learn and know how to manage patients and how to make clinical observations leading to research questions just the same as the fellows were. And I wasn't expected to put catheters in people and, perform ablations, but all the other stuff I was. And I didn't know any better. I didn't know that that wasn't the way that it was everywhere. So I just feel very fortunate that that's kind of where I came up. And I was very, again, fortunate to be introduced to Heart Rhythm Society. It was part of my upbringing as a nurse to belong to the American Nurses Association, belong to your specialty organizations. And for me, Heart Rhythm Society has been a really important specialty organization. I joined the moment that I could early in my career and have been so blessed to be part of this society and this community ever since.
Yeah, I mean, you have participated in so many roles within the Heart Rhythm Society, different committees from education to governance to patient and caregivers, ultimately being on the board of trustees. And, I was lucky to be able to serve with you together on the board of trustees, which was an amazing time and a very kind of pivotal time for the allied professionals, that we were able to get the Allied Professional Council back again. So just some, amazing level of participation within the Heart Rhythm Society. But, you took your career far past that. Let's talk a little bit about kind of other things that you've been involved with. As I mentioned kind of in the introduction, that you're also a tenured track assistant professor at Arizona State University. So can you talk a little bit about your role there?
Yes. So I love education, and that's been part of my service to Heart Rhythm Society. I would say the things that really, really, really drive me are education and service. And it feels appropriate that my career has found its way toward academia as a nursing professor. So after I had been in practice as a nurse practitioner for about 10 years, that was when the Doctor of Nursing Practice degree was kind of emerging. And I was fortunate living in Phoenix that Arizona State University was one of the early DNP programs in the country. And I felt like a little itch, like there was more that I needed to do in my career, which was otherwise very, very full being a clinician. And so I went back to school for a postmaster's doctorate and really enjoyed it quite a lot and started teaching from there. I was recruited to help start up a DNP program and run a DNP program in the state of California. And pretty much as soon as I finished my DNP, I realized I had some more questions, and I had some bigger questions. And that led me to my PhD outside of nursing and outside of healthcare, as a field. And the reason for that was I saw that there was I had very big questions about healthcare delivery and society. And I saw that clinical research was doing a lot of really important work. And I also saw that social science research was doing a lot of important work. And I also saw that those two weren't really talking a lot. And I felt like there needed to be bridges in the research world. So I set out to do some of that work. And I'm fortunate that I, had an opportunity at my home institution of Arizona State University and, could pursue this interdisciplinary social sciences degree. And that really then cemented me even more fully in being in academia. And it was really important to me to be able to keep a foot in clinical practice. And I've just been so fortunate with the people who have surrounded me throughout my career. My private practice at the time, which now is part of Honor Health Cardiac Arrhythmia Group, they were so generous to make space for me to really carve back my clinical practice, but hang on to, that panel of patients that I've been caring for now for 15 years, longer than 15, like 17 years. But while I really stepped up my role at the university. So does that answer your question?
Oh, yeah. Of course. Well, I think as a stepping board from all of that, you've been very active in public health and regulatory matters and civil service as well. And I understand that you actually ran for, was it a local congressional seat?
Yeah, so I ran for the United States Congress in the district where I live. And really, truly, like, service is one of those things that really drives me. And that notion of serving, if there's a need, then I feel a responsibility to help to meet that need in the ways that I can. It's really what drove me to sort of put my hand up to volunteer for Heart Rhythm Society work. And it's very much why I made the decision to stand up for public office several cycles ago. Now, I am not serving in the United States Congress, so you can see how that election went. But I will say that that experience of stepping outside of my very comfortable spaces that I knew how to do for many years as an EP provider, as a nurse, as a college professor, and stepping into electoral politics was really unfamiliar. I learned so very much. I met people I never would have met in ways that I never would have met them. And it really, really changed my life. And the most important thing, it did many, many very important things for me. But the most important thing was that it taught me and really reinforced for me the importance of service. If there is a need and I can see that need and I can meet that need, then I have an obligation to stand up and do what I can to meet that need. And it's not different than my now colleagues in, fire departments, because I have started to do a lot of work with public safety officials. It's not different than, if there's a fire, you got to run into the fire and take care of what needs to be taken care of. And my policing colleagues, if there is a problem that needs a police response, you got to run into it, and it doesn't matter what it is. Mm-hmm. And so that's a lot of the ethos that I step forward with, and a lot of why my research has now inflected into homelessness and older adults experiencing homelessness and dementia and information literacy in places that don't have internet access around the world and here in the United States, which feels very far afield from EP. It's in that spirit of service. And one of the things I'm really excited about, and just had a meeting about this morning, is, ways to sort of marry those areas of research back to my clinical experience in cardiovascular health. So more to come.
Yep.
Yeah.
Yep. One of the things that you have always kind of described your career as unconventional.
Yes.
And I think it really, truly reflects that, from your roles ranging from clinical practice to academia, to political candidacy, to, community and social outreach. Mm-hmm. You mentioned service as one of the things that kind of has driven you to such a diverse path. But can you think of any other ways, different experiences, how this really changed your approach to healthcare?
Yeah, absolutely. One of the things that I think the sense of service that drives me has forced me to listen to what the needs are, right? Of whether it is my patients or the community that I'm working in, or what have you. And that is really sort of flips on its head, I think, the way that we as healthcare professionals often think about the work that we do. A lot of times as healthcare professionals, and I know that I was taught in my clinical training that, like, here's the pathway, right? And we got to get our patients on the pathway. And here's the guidelines. And we need to execute these guidelines, on behalf of our patients. And one of the things that I've learned from the various service opportunities is that that's maybe not always the right way. I don't want to say it's the wrong way, but it might not always be the right way to approach problem solving. And I'll give you an example. Many, many years ago, we had a patient who came back into the office after having had a BIVICD implanted in the hospital and also had AFib and had been placed on Ticastin and warfarin. And this patient came back to the device clinic for a wound check and brought with him his remote monitoring box. I'm not going to say because I don't remember which company it was, but it was one of them, right? And my nurse colleague in the clinic said, "Oh, yeah, no, you don't need to bring that back. You just plug it in next to your bedside," what we always do for patients, because this is the path, right? And this patient said, "Oh, well, I'm staying in a homeless shelter right now, and so I don't really have a bedside plug. And I also am afraid that stuff tends to get stolen in shelter settings. So I figured I would bring it back so that somebody else could use it." And which was like heart-wrenching, right? Yeah. Like that a person who is experiencing homelessness would want to make sure that somebody else could, make better use of this, who needs it. And I thought, oh my goodness, wow, how did this happen? How did we put a BIVICD with expectations for remote monitoring into a person who is unhoused? And how did we give this person who is on the street, without a stable living environment, how did we give them Ticastin, which costs an arm and a leg at that time, and has to be taken every 12 hours like clockwork, and warfarin, which requires a stable and steady diet, right? Like, whoa, like how we missed the boat for this gentleman. Yeah. And I went to my colleague and said, like, what are we doing? And my colleague said, it would be unethical for me to consider that individual's personal situation. I must do like the best medical care. That's the only ethical thing. And I thought, oh, wow, this is really broken. And I think that is completely the wrong way. And it really made me question a lot of the ways that we practice medicine and a lot of the ways that we think about ethical care for patients. And it really made me take an important step back so that I reframed the way that I thought about patient care and treatment to start with, where are they at? Like, yes, I may want them to get somewhere else, but where are they at today? And that's always where I have to start. And that really led me then to thinking about how can I serve these communities in ways differently than I may have thought about before, and really has forced me to ask questions differently in different, in different places and to different people, and really has changed the whole way that my career has gone, because I, again, feel like, oh man, if I ask about, are you on fire over there? And they say yes, then I got to run over there and figure out how to put out that fire, or at least like cook something on it,
No, for sure. And I think that's, one of certainly the strong suits of allied professionals, that, this is where our innovation comes in, every day in the office when we're taking care of people, particularly like that, who have unique needs, and to find ways to try to take care of them safely. So thank you for sharing that experience. So, in what ways do you think that the recognition, so the receiving the Distinguished Allied Professional Award from the Heart Rhythm Society, reflects both your individual contributions and expanding the role of nurse practitioners and other allied professionals in heart rhythm care? Why is this award important?
Well, very personally, I will admit that I cried when Doug Packer called me and said that I had been, awarded this. I was I'm so touched that my colleagues and my professional community would think of me in this way. And particularly because my career has been so unconventional. And I've been so fortunate that, as and Julie, like, I will, to the day I die, I will say that you are the first person who said that I have gone career off-roading. And it's true, right? And I just feel so fortunate that Heart Rhythm Society and the whole heart rhythm community would do something other than say, oh, well, she's out of this picture, but rather to be expansive in understanding what that picture is. And I sincerely hope that the example that I bring to this picture can show other allied professionals that there are a lot of ways to be an allied professional in heart rhythm care, and that there's a lot of ways to interpret what heart rhythm care can be and maybe ought to be. And, I have said today, and I'll say it for the rest of my life, I'm so fortunate that I have been met by people throughout my career who have made these spaces for me and these opportunities for me to kind of elbow outside of the norm a little bit. And I hope that other people will see that example and do two things, right? Themselves sort of gather the courage to maybe nudge themselves outside of the norm, and as mentors and as facilitators, create spaces for people who are coming up to edge and move what the edge is, right? And what the edge can be, and to change some of those boundaries from what we might normally think of as heart rhythm care to maybe being dotted lines, right? Semi-permeable membranes instead of cell walls, right? We are animals and not plants, after all.
That's right.
Yeah.
I love that piece of advice. That's wonderful. Just, you have been lucky with some great mentors throughout your career. And, one of the things I always tell my daughter to, surround yourself with people that are brighter and smarter than you, because you rise to their level. So, for sure. And I think, one of the other things about your career is that the analogy with the Heart Rhythm Society is it really, you align with the strategic plan of the Heart Rhythm Society. Your entire career has with advocacy, innovation, advancing practice. So you're living and breathing the Heart Rhythm Society kind of motto, their strategic plan. So I couldn't think of anybody better to receive this Distinguished Allied Professional Award this year. And, a heartfelt congratulations to you, Heather. I'm not sure when you sleep with all the things that you do.
Not enough, but I study sleep and homelessness now. And so I do try to be a proponent for better sleep. How's that?
Oh, absolutely. Absolutely. Well, thank you so much for joining me here today on Advancing Allieds. And I look forward to what you're going to do in the future. Who knows?
Who knows?
Who knows?
Yeah,
It's exciting.
I'll let you know when I find out. Yeah.
Enjoy following your career path. It's awesome.
Thank you so very much.
Congratulations. All right. Well, thank you. This is Julie Shea for Heart Rhythm TV.